The disease that I will be talking about is multiple sclerosis, also known as MS. It is an autoimmune disease in which the body's immune system mistakenly attacks the myelin, which is the fatty substance that surrounds and protects the nerve fibers in the central nervous system. This disease affects almost everyone, children, women, men, and elderly wise, but it is 2 times more likely to be affecting women than it is men. There are 400,000 people in the United States that are being affected by this disease right now, which leads to a 1 in 1,000 chance of getting it. Some factors that can lead you to having MS are vitamin D deficiencies, genetic predisposition, and environmental triggers. Some signs and symptoms are fatigue, which this is a very, very common sign and symptom for this one. Trouble walking and loss of balance, blurred vision, poor contrast, and trouble seeing colors, numbness and tingling of the body, and worsening memory and difficulty concentrating. With these people, you want to provide them with a support group, encourage them to perform their activities of daily living, meeting with their friends, and pursuing hobbies. And you also want them to meet with a therapist to provide both emotional and physical support for them. Some tests used to define this disease are blood tests, which rule out other disorders, a lumbar puncture, which shows abnormalities in the antibodies, and an MRI that shows lesions on the brain and spinal cord. There is no cure, but the signs and symptoms can be reduced or delayed. Some treatments for this are clinical trials, which lower the signs and symptoms. When doing a clinical trial, you want them to get extra rest, exercise, cool themselves down, so have a period of just relaxing, a balanced diet, and relieve stress. A BRI, which is a biorepository of patients with MS. This speeds up the recovery from attacks, slows the progression, and manages the signs and symptoms. Some treatments for attacks are corticosteroids, like prednisone, and a plasma exchange, which it removes the infected blood from your body and cleans it out and then returns it. Some other medications that are used for people with MS are muscle relaxants, meds to decrease fatigue, and meds to increase the walking speed. And also physical therapy is good for them.